how do you define diarrhea? The diarrhea is defined as passage of abnormally liquid or unformed stools at increased frequency. Okay, stool weight of more than 200 grams per day is considered according to your Western diet. But ideally, 200 grams per day is already present in our Indian diet. So we give it a cushion about 250 to 300. If your textbooks more than 200 grams per day, Western diet is considered diarrhea. And how do you classify diarrhea? Acute, persistent, and chronic. So acute usually persists for only less than 2 weeks. Persistent is 2 weeks to 4 weeks, and more than 4 weeks, any diarrhea is considered as chronic. What are two conditions which you should not forget while talking about this? You have the pseudo-diarrhea. The pseudo-diarrhea means what? You have unformed liquid stools, but they are frequent small volume stools. Rectal urgency and tenesmus is also present. So whenever you have urgency, tenesmus, which means the rectum is involved. Okay. So why do you say that? Because rectum actually acts as a reservoir. So even if your ascending colon transverse is your main reservoir, rectum also helps to accommodate. So when the rectal function is lost, either because of some inflammation like inflammatory bowel disease or any proctitis or solitary rectal ulcer, anything which causes a pathology to the rectum, that reservoir function is lost. So the patient has a tendency to pass stools. They cannot accommodate each and every time they feel like going. So it's usually small quantity, unformed stools, but associated with urgency and tenesmus. Tenesmus is a feeling of incomplete evacuation. So even after passing also, the patient still feels they have some stools left behind. Fecal incontinence is the involuntary passage due to, it's almost always due to structural causes or neuromuscular causes. So neuromuscular, I mean not only the central nervous system, but also in the local areas. So if you have a parental nerve injury, that's going to supply your sphincters. So if there is a parental nerve injury post-surgery, or if the patient has had long decades even after a complicated childbirth, they can have injury to the nerves. That itself can result in some fecal incontinence associated with pelvic floor dysfunction. Then overflow diarrhea. So overflow diarrhea is fecal impaction nursing homes to patients. So what happens out here is you have your colon coming this way. Okay. There will be actually constipation. So large amount of stools will be present, but these stools actually get impacted. They get impacted and you have seepage through the sides. This is what happens. So when you have this kind of a seepage through the sides, always do a rectal examination and see if you have stools obstructing. Because what is coming out as liquid may not actually be diarrhea. It may be seepage from across the stools. Okay. And two things which I forgot to mention when I was talking about the motor function. One is you have the migratory motor complex. Okay. In the small intestine, you have the migratory motor complex, MMC. And you have the phasic contractions which help in mixing as well, the small phasic contractions. So MMC, that's a migratory motor complex, basically does housekeeping functions, which means every 2 to 3 hours or every 90 minutes you can say, it keeps cleaning the small undigested food. That's your housekeeping, but it is just goes on cleaning. So every 90 minutes, lasting for about 4 minutes, there is cleaning of the non-digested or undigested food residue present in small intestine. Then you have the mixing ones which help in passage of the food from your small to your ileum. At the ileum, once the food enters the ileum, you have large bolus movements. From there, it goes into the colon. So this MMC actually doesn't go into the colon. In the colon, you have two other contractions. That is the basic tone of the colon such. Plus, you have the phasic contractions. So phasic contractions, they last for about 15 seconds. Less than 15 seconds. Apart from that, you also have the second one, that is the high amplitude propagatory contractions. So like the name suggests, HAPC, high amplitude propagatory contractions. High amplitude, which means more than 75 mm. So in your small intestine, you have your migratory motor complex and you have the phasic. In the large intestine, you have your basic tone. Apart from that, you have the basic contractions less than 15 seconds and the HAPC. So the HAPC is what is responsible for propagation, P for propagation. High amplitude propagatory contractions. Okay, it's propagatory and ideally it comes at least 5 times a day. It's more after waking up and postprandial. That is when your HAPCs are usually seen. These are huge contractions which help in emptying of the colon after waking up plus postprandial. Now, acute diarrhea. The most common cause for acute diarrhea is infections. Infections of various causes. Okay. Non-infectious pathology is usually because of drug-induced medication, because of any food intolerances or ischemic colitis, especially if the patient is above 50 years, complaining of severe lower abdominal pain and associated bloody diarrhea, or even toxins. So toxins, drugs or medications, and food intolerances apart from this. They are also responsible for non-infectious causes. Otherwise, what most of you will be seeing in your practice is infectious causes. So infectious causes, the various infections what we need to know. So what is common in travelers? You have travelers diarrhea. Commonest caused by enterotoxigenic E. coli. Sometimes it can also be caused by a Shigella, Salmonella, Campylobacter, or even Giardiasis. Daycare attendees, they are more prone to Giardiasis, Shigella, Cryptosporidium, and norovirus. Similarly, institutionalized persons. So institutionalized persons may be on various drugs. They may be on antibiotics. So antibiotic-induced diarrhea and Clostridium difficile, C. diff, that's more common in institutionalized. In immunocompromised, you have a set of infections which are more common. AIDS, okay, example AIDS. Hemochromatosis as well, iron overload. So iron affinity organisms like Yersiniosis. Okay. Pathogens, infectious, Shigella, Salmonella, Campylobacter, enterotoxigenic E. coli, these Cryptosporidium Giardia. Most common cause of acute infectious diarrhea will always be a virus. So it is not this bacteria. That is why you don't have to give any antibiotics because most of them are self-limiting. Okay, exposure to seafood, you have Brio, hepatitis A as well, which is common. Yersiniosis is an organism which affects which causes, it's an invasive diarrhea, what it causes. So it invades means it goes right across into the mucosa and causes an inflammation resembling an acute appendicitis. So the patient will complain of severe right iliac pain. Patient will resemble an acute appendicitis, invasive yersiniosis. Salmonella, Campylobacter. Salmonella, especially the patients have history of eating from the picnic or the banquet or eggs or mayonnaise or cream. Campylobacter is also quite common. And what we need to know is that often Campylobacter, they are quinolone resistant. They respond to azithromycin. E. coli. If it is a hemorrhagic E. coli, you have different types. E. coli, different toxigenic. You have the adherent or the pathogenic, the enterohemorrhagic E. coli. So enterohemorrhagic is from undercooked hamburgers. So enterohemorrhagic, EHPC. H for hamburger. Just remember that. So there are certain lead points in the questions what you might see. For example, if they talk about immunocompromised individuals, always think Neisseria, Treponema pallidum, syphilis, gonorrhea, and chlamydia. Opportunistic infection in AIDS can either be bacterial, it can be viral, or it could be protozoal also. So bacterial infections, Mycobacterium viral, HSV, CMV. And the protozoal infections in AIDS patients. These are all infectious type, okay? That is, you have your bacterial as mycobacterial, you have your viral, which is your HSV and CMV, and you have protozoal. So protozoal can be any, it can be even your cryptosporidiosis or giardiasis. What is more common? Cryptosporidium. Cryptosporidium is also common in immunocompetent individuals that we have to know. Cryptosporidium, microspora, and isospora. Okay, these are supposed to be these are organisms which are parasites which preferably or preferentially affect AIDS infected individuals.